is professor of neurology, medical oncology, molecular pharmacology, and experimental therapeutics here at Mayo Clinic in Jacksonville. He actually has been at Mayo Clinic since 2017, and prior to that was the director of the Brain Tumor Research Center at Cleveland Clinic, and also the director of neuro-oncology at Columbia University New York Presbyterian Hospital, and director of neuro-oncology at the University of Alabama at Birmingham. And based on that extensive experience and 28 years of NIH-funded laboratory investigating brain tumors, he's going to be speaking to us today about the evolution of a neuro-oncology program.
So I was asked to give a talk about the vision of the future for neuro-oncology, and so I want to emphasize with this question mark that this is my own personal vision and it's not necessarily anyone else's. I take full responsibility for it, and if there's any relationship between my vision and what actually happens, I probably shouldn't take credit for that either. So let's start off. We can't figure out where we're going if you don't know where you've been. So where's neuro-oncology been over the last couple of decades? Well, this is a bit of an oversimplification, but prior to the early 1990s, the field was really just a group of small groups of clinicians and clinician scientists working in relative isolation without even their own organization or own theme-directed meeting. That began to change in the early 90s, first with the establishment of several NCI-funded brain tumor adult clinical consortia, the NABTT, New Approaches to Brain Tumor Therapy, and the NABTC, the North American Brain Tumor Cooperative. These were clinical consortia of multiple institutions around the country that would cooperate to try to implement clinical trials based on drugs that were in the pipeline. This was followed within 3 years by the first meeting of our now professional society, the Society for Neuro-Oncology in Santa Fe, New Mexico. At about that same time, the FDA approved gliadel, which are bioimplantable, biodegradable wafers impregnated with BCNU. In 2 years after that, the Pediatric Brain Tumor Consortium, the children's version of the adult brain tumor consortia that were formed, was developed. In the same year, FDA approved temozolomide. In 2007, the specialty of neuro-oncology was recognized by one of the American boards as a certified subspecialty. 2 years later, FDA approved bevacizumab, and 2 years after that, Novo TTF, or Novocure, a device that generates alternating electrical fields and is being used now for treating patients with glioblastoma. So that's where we've